Hi, I'm here with Brandt Passalacqua, Director for Breathing Deeply Yoga Therapy. And today we are talking about mental health. And I was wondering, Brandt, if you could tell us a little bit about how a yoga therapist's approach to mental health is both different, but also complementary to sort of mainstream approaches to mental health.
Well, I think the first thing to kind of outline might be what we're working with in terms of mental health as yoga therapists versus like what a psychiatrist or psychologist might be working with. So, you know, traditionally, I guess, or standard of care, right, is you go to a mental health professional and you talk to them and you work through their problems. That's like one part of it, and then the other part of it might be maybe strategies you use, in your own life born out of that. And then I think the probably most popular third component would be drugs and, drugs that help you change your cognitive situation a bit. So that's that sort of standard of care. And then we have yoga therapists, which are, still looking clearly at the same person, but our assessment and our practices are quite different. So what we might do is take a look at someone and sort of evaluate them or assess them through our model. And that would lead us to doing physical things to help their mood, say, not, for like cardio, but to change, their mood states or stabilize their mood. It might have us doing breathing practices, again, to do the same thing. Or possibly change like their nervous system situation. And then also maybe chanting or meditation techniques to bring the person into a process where not only would their brain physically change by creating different neural pathways, but also a discovery process for the person themselves so they can have more insights into their situation and maybe make some changes that they wouldn't have thought of before. So in a way, it's completely complementary because we're not working, with the same kind of techniques. So people usually get different results from yoga therapy, and certainly in our school and in my practice, I've seen people get really good results by using the two together.
When you're working as a yoga therapist with someone, obviously you're not necessarily diagnosing them with anxiety or depression. Could you talk a little bit about what you talked about with assessment? What does that look like? Is there a particular construct that you'll go to when it comes to mental health?
Yeah, so we see things slightly differently than like the Western medical system would see them. So on the Western medical side, someone might have anxiety or depression, say. On our side, we use an Ayurvedic model. And in our school, we use this doshic model where we will kind of look at the Western piece, but then also match it with this Ayurvedic model. And then from there, that will lead us to the practices we give any individual. So one person with anxiety might get, a slightly different set of practices than another based on that assessment. So in that way, we feel like we're much more specific because we're really looking at the individual and saying, well, these practices have been shown to bring more balance to minds of other individuals that have a sort of similar assessment, from our point of view.
Right. So if I'm a mental health professional and I'm, interested in, incorporating some of these techniques, it's maybe not enough to, teach somebody kind of a regular, something you might have learned in a yoga class. You probably need to go a little bit further and have the ability to choose applicable breaths or applicable movements or meditations based on a construct. It's not just enough to say, oh, everybody try this breath.
Yeah, absolutely. And, of course, many people have gotten benefit from going to yoga class, right? We're not going to, people go to yoga class, they're, they're experiencing a lot of anxiety in their lives, and they say, oh, yoga has made me less stressed. And so in that way, it's great. But that is just like the tip of the iceberg in terms of really what yoga techniques have to offer individuals. So the assessment is key. And I will say, a lot of those classes are not appropriate for a lot of the people in them. And if we're talking mental health, example I could give is somebody probably who's suffering from really intense anxiety and having panic attacks, and then shows up at their local yoga studio and takes a hot yoga class. Like probably that class, based on our assessment techniques, isn't going to match them. So, and it's not the hot yoga class's fault that they're in the wrong class, and it's not the person's fault they're in the wrong class, right? It's just that they haven't talked to a yoga therapist who would give them specific practices that would work better for them.